In the health minister's reform, improving pre-hospital emergency services was key, a starting point. A few years later, results aren't there yet, not according to Quebec's Auditor General. Here's why. Half of all Quebecers don't have access to first responder services, those who can be on site before paramedics arrive. The problem is that in these municipalities, especially in rural areas, in nearly half of very urgent calls, it took more than 10 minutes for paramedics to reach the patient.
Scientific studies have shown that in the case of a cardiorespiratory arrest, after 10 minutes, the chance to survive is almost zero.
The Auditor General's report states paramedics also spend way too much time waiting to transfer their patient to the ER. It says non-urgent calls should be systematically triaged so they don't monopolize resources, and often means of transportation other than an ambulance should be used.
Écoutez, c'est exactement ça.
Frédéric Maheu has been a paramedic for 20 years. He says the report reflects what he sees on the job. His fears of not arriving on time to save patients have increased.
On arrive chez des patients, puis ils nous attendent depuis plusieurs minutes, plusieurs heures. Ils sont en pleurs, sont en souffrance, ils sont inquiets, ils font de l'anxiété normalement. C'est très difficile d'arriver là et de dire, écoutez, j'aimerais ça venir plus rapidement, mais je ne suis pas capable d'arriver à l'heure, je ne suis pas capable d'arriver à temps parce que j'étais pris soit au centre hospitalier, j'étais pris sur d'autres appels.
On ne peut pas avoir une ambulance à chaque coin de rue au Québec.
With the province's vast territory, it's unrealistic to think that we'll put an ambulance on every street corner, said Premier Legault. His health minister was fast to focus on the positive.
What is satisfying is that we are improving, because we know that it's not perfect yet. There are still a lot of things to be improved.
But for the opposition, the health minister's response doesn't make the cut.
That is probably at the top of the list of a lot of people when they think, what do I expect from my government, is that when I'm in a time of need, an ambulance will show up in a timely fashion.
The health minister says the best practice in Canada is an 8-minute response for urgent calls. Christian Dubé says paramedics have already cut the response time by 20% in the last year, and he wants Santé Québec to integrate more first responders.